Welcome to Medical Monday. Thank you for joining us this month. I'm Jessica Hill, the host for Medical Monday, and I'm the Director of Nursing here at Southeastern Community College. And we have the Surf Doc, Dr. Peter Chambers, with us again, co-hosting, and he is a specialist in emergency and family medicine. This month, we're going to be talking about family and your health. Welcome.
Hey, it's good to be back. Small topic, huh? Family and your health.
Right.
Where do we start? Oy.
Could it be any broader?
Exactly. People ask me, that's a common question I get. What can I do to keep my family healthy? You know, I'm in the supermarket, I'm at the car wash, somebody always will come up to me and talk to me. And what they ask is, what can I do to keep my family healthy? Particularly now, when we have all these germs, it's cough and cold season, and we've been through the COVID pandemic, you know, and I answer them with something that they don't expect. Number one, big picture, wash your hands.
Wash it. The number one thing you can do to prevent yourself from getting sick, right?
Wash your hands, okay? Number two, wear your seatbelt.
Absolutely.
With all this buckle up for safety, people don't wear their seatbelts. Wear your seatbelt. It's real clear. When I'm working in the emergency room and there's been an auto accident, people that don't wear their seatbelts, they get banged up. Wear your seatbelt. Number three, if you're involved in some kind of off-road vehicle, you're riding a motorcycle, you're on a hoverboard, you're rollerblading, wear a helmet. It's real simple. Wear a helmet. Wear a helmet if you're skiing. Wear a helmet if you're water skiing. Wear a helmet. Finally, here's one that's a little more traditional health related. Keep everybody's weight down in the family. If you're overweight, it puts you at risk for so many health-related issues.
Illnesses, right?
And of course, there's the ones that everybody knows about. You know, have you heard smoking's bad for you?
Right, right.
You know,
vaping too.
Vaping's bad for you, smoking's bad for you, all that traditional stuff. But I want to raise everybody's consciousness to those other things we're talking about.
So it's interesting, everything you mentioned is all measures to prevent
Correct.
injuries or diseases. And when we talk about health, we sort of think about three different categories, right? Acute problems, chronic problems,
Right.
and then preventing
Preventative
problems.
And a lot has to do with your provider. So first of all, if you want to maintain health in your family, have a healthcare provider. Have a designated person that you go to as your family provider. With this new generation now, I'm seeing that less and less people have that family doctor that we used to say. Who's your family doctor? I ask younger people, they don't even know. They don't care.
Right.
They go to urgent care, they do it on their phone, you know, but having a provider that you can go to with questions that gives you some guidance is very helpful. The healthcare system, you almost need a professional navigator. Like you need your family doctor and a health navigator. It is confusing. Where do you go? What kind of provider? What tests do I need? It's tough. It's tough for me.
It's very difficult to navigate, even as a healthcare professional, which you are and I am. So for people who don't have that type of training or that vocabulary to talk to providers, sometimes it's really difficult for them to navigate the system.
And there's so much health information available now. YouTube, TikTok,
Google,
you know, and that's great because it raises people's awareness and people come in with questions. But on the other hand, it's tough to sort out.
Right.
You know, there's so many conflicting things. So, you know, having that one designated person for your family is really a good idea.
And I think in this technological age, we have made it so easy to, at least lately since COVID, it's very easy to access healthcare because you can log on and find a doc on your phone a lot of the times, right?
But it's not like that personal relationship. They can give you those acute problems you're curious about. Does this look like a bug bite? But overall, somebody to manage your health, having that person you can sit down across from. And again, I said this before, I think I said it in another one of our Medical Mondays. If you don't get along with your provider, don't go to your provider. Have somebody else.
Right, find somebody that you actually like.
Yeah, I have heard many people say, oh, I go to the doctor, all he does is make fun of me. I don't think that's who you want as a provider.
Sure, find somebody else.
Right.
And there are plenty of places around here. We're really lucky to have the system that we have here. We have a good hospital here in our community.
Yeah, we have a great system, but it's overwhelmed. I mean, there are more people than providers. So sometimes getting in is tough, but you got to persevere, you know.
Right. And keep your appointment.
And keep your appointment, yeah. And the other thing is, utilize the emergency room for emergencies. A lot of times people don't have providers and they go to the emergency room for those, you know, routine medical care things. We'd rather you go there if you don't have any medical care or you're going to run out of your medicine and you can't get in and say, please see us. We don't want you to go without health care in the emergency room. But don't rely on it as your sole medical contact.
Right, because continuity of care is really important too. So
Yeah.
establishing that one person that you see every year
Right.
helps with that continuity of care. They know what has happened to you in the past, and
Right.
they can link things together.
Yeah, and they can look at your record and figure out what's going on.
Right. So you mentioned coming to the emergency room. Let's talk about that a little bit. Some
Okay.
people might not understand what warrants me going to the emergency room versus me going to an urgent care. What can I do as a citizen to not overwhelm the emergency room system, which I'm sure you see a lot of because you work there.
Every day.
And so when should people go to urgent care versus the emergency room?
If you're having difficulty breathing, if you're having chest pain, if you have stroke-like symptoms, weakness, can't feel, of course, go to the emergency room. Just deformities to extremities from injuries, loss of consciousness, see the emergency room. Those other things, those acute visits where you have earaches and sore throats or rashes or a minor sprain, urgent care is a great place for you to go. The emergency room is there for those emergencies, and you want the providers there to have time to be able to deal with your emergency, not be dealing with work notes.
Right.
I mean, I have people come in and wait hours just to get a work note. I mean, we want to give them a work note, but
Right.
it'd be better you got that from your primary care doctor.
Sure. And I think one thing that some people might not understand is if you go to the emergency room with a non-emergent problem, like an earache or a mild cough, you might wait a whole lot longer
Correct.
than the other people because you see the people who have the most emergent need first.
Yep.
So sometimes you can get seen quicker if you go to an urgent
care.
care if it's a non-emergent
I
problem.
frequently tell people that are in the emergency room and they complain about the wait, and they go, I've been bypassed, or I've been sitting here, or no one's coming to see me, and I go, that's a good thing, because if you're in the emergency room and you're not being seen immediately, that means you're not dying.
Right. That's
know,
right.
take your
Because you're
time.
going to see those people first,
But
as
go-
you should.
And you go to the emergency room, you're gonna wait. That's the bottom line. And currently I can tell you in Los Angeles, waits in the emergency room are 24 hours. Average length of time in one of our local emergency rooms, not here, one of our surrounding areas, 14 hours in the emergency room. And there's days when you'll wait several hours in our local emergency room. We try to get everybody in as fast as we can. We triage people to where, you know, if you're really sick, we'll see you. But do your part. Go somewhere else if you have a minor complaint.
Right. And it just goes back to what you said. We have a shortage of healthcare staff and more people to see than we, you know, either have room or people to handle.
Yeah.
So sometimes the waits become long.
You know, with COVID, something I tried to tell people, you got to learn how to take care of yourself. You know, you can't just rush off to the emergency room. Remember during COVID, it was hours and hours away. Learn how to take a temperature. Believe it or not, people don't know how to do it.
So important things to have at home when we're talking about family and your health.
Thermometer.
Yes, a
Have a
thermometer.
thermometer. Have a fever reducer, a pain control medication, having that ibuprofen, having that acetaminophen, having something for congestion, have some eye wash, you know, have your little home pharmacy of over-the-counter medicines so you don't have to go to the emergency room because you don't have Tylenol.
Right.
If it's in the middle of the night and you don't have Tylenol and it's an infant, please come to the emergency room. But a lot of these visits you can head off by being prepared at home.
Being prepared at home.
Yeah, learn how to take care of yourself. Learn how to reduce a fever. Learn how to treat a rash. You know, learn how to get something out of an eye. There's lots of courses out there, either online or the American Red Cross, that have like home nursing skills.
Right, little first aid courses. And if you want to be a nurse, come out here to Southeastern Community College. We have plenty of general education classes and a whole wonderful nursing program if you are interested in that career path. And we also have a great EMS program.
Yeah. And being an emergency medical technician doesn't mean you're necessarily going to go out there and work on an ambulance. It's great for the community to have as many emergency providers as we can. You never know what kind of national disaster we're going to have. Your neighbor is going to call on you. Take care of yourself, take care of your community. This is it. We got great curriculum here, wonderful teachers, state of the art. And I've been to colleges all across the United States. Let me tell you, your programs here at Southeastern are top notch.
Thank you.
State of the art.
I think one thing that makes our programs really special here is that, well, number one, we have faculty who care about these students, and we really do invest our time in them because they are coming out of this program and taking care of this community where we live. So we want them to be the best of the best.
You see a commitment with the instructors here. I mean, I've taught at major medical schools, I've taught at colleges, I've taught at junior colleges, and the faculty at this place are just paramount. I mean, it's incredible.
Thank you. We appreciate all your support. You help us out.
Yeah, it's fun.
Thank you. All right, so health in your family. Any last parting words for the citizens of Columbus County?
Please be careful.
And wash your hands.
And wash your hands. It's kind of silly. Be careful, you know?
Yeah.
Don't have that ladder balancing on a book. You know, be careful. A lot of people, most injuries can be prevented, and so keep that in mind. We don't want it to be life-threatening. Sure.
Thank you for joining us.
It was fun.
Yeah,
See you around the water next time.
Yes.
Water safety,
can't wait
my favorite
for spring.
thing.
Yes, these next topics coming up in the next couple of months are right up your alley.
Great.
Thank you. Thank you for joining us for Medical Monday this month. We hope to see you back next month. Stay well.